All right. Welcome, everyone. Good evening. Sorry for the technical difficulties. Let me start by thanking Dr. Izagiri for joining us this evening. And I just want to thank everyone for joining who is either live on Zoom or on Facebook. We appreciate you joining these webinars to learn more about how to support your children with special needs. For those of you who this may be your first time, I'm Lisa Valerio, and I am the founder of the Phoenicia Foundation. And it is our goal to kind of plant the seeds and provide resources to those with special needs. And so our latest tagline is, we plant the seeds, nurturing change for special needs. And with that, what I'm going to do is just hand this over to Dr. Izagiri, who I cannot thank enough for taking the time to educate us on to medicate or to not medicate. So with that, I'm going to go off. Those of you who are on, if you have any questions, please put them in the Q&A box. And those of you who are also on Facebook, if you can, put the questions in the comments, and we'll look at those, and then we'll come back at the very end and answer some of the Q&A that we receive. So I'll let you take it away, Dr. Izagiri.
Yes, good morning to everybody and good evening to all those listening to us from the other parts of the world. Thank you very much, Lisa, for inviting me, and also to Phoenicia Foundation for continuously supporting our children who needs our special help. So I am Dr. Feliza Izagiri. I'm a developmental pediatrician. I'm currently based here in Davao City. So it's one of the good things maybe that came out of this COVID situation is our ability to connect with each other even through this online method. And I think that's one, if you're going to look at the rainbow, that's one of the things that came out positively in a good way. So for this morning, I would be talking to you about medication. So we would hope to at least enlighten the parents who are listening to us right now, the teachers, the therapists, on the reasons behind giving our children with special needs medication. So these are just my disclosures for this morning. I do speak for milk companies, but my talk for this morning doesn't have any conflict of interest, nor am I endorsing any specific brand of medicine that I would be talking about later on. I would try to make this talk as informal maybe, or as simple as possible, while not going through a very medical lecture. So these are the points that I would like us all to consider for this morning. I will just go briefly into the current situation of mental health concerns and common developmental disorders in the Philippines and in other parts of the world. I would like to talk about approach to management of developmental disorders in general. I would also like to answer the question, what is the role of medications in developmental disorders? After that, I'll tackle some issues in medication, go through briefly some commonly used medications, and towards the end, I'll be giving some insights into how we go about in treating children with developmental disorders. So to start off, since majority of our listeners are from the Philippines, current situation right now and current data would show that 1 out of 7 or 5.1 million Filipino children have disabilities. From the National Statistics Office, they mentioned that mental health illnesses are the third most common forms of morbidity for Filipinos. So morbidity means common form of disorder or disease perhaps. So the most common morbidity or illness is actually diarrhea, and then followed by respiratory illnesses. Now we come in third, so that's something. In the global setting, the WHO in 2020 mentioned that 10 to 20% of children and adolescents are affected by mental health problems, and 50% of them are in the less than 14-year-old age range. So that means these are our young children and our older children who are not yet in the teenage or adolescent period. Let's talk about specific disorders. One of the more common developmental disorders that we are really seeing is autism. So from this picture, you can see that through the years, there is really an increase in number of kids diagnosed to have autism. In 2004, it's 1 in 166. If I would go back further, when I started my training as a developmental pediatrician in 1999, it was 1 out of 1,000. And now in the 21st century, you can see that there seems to be an exponential growth in the number of kids diagnosed with autism. And in the latest data in 2020, these are figures, by the way, from the Centers for Disease Control. It's now 1 out of 54. In another developmental condition, which is also very common, ADHD. So that's attention deficit hyperactivity disorder. So it has been seen in data that 3 to 5% of the 0 to 14-year-olds in the Philippines have ADHD. That's roughly 1.63 million. I think our current population right now in the Philippines is somewhere in the 109 million. So this accounts for the number of kids who may have ADHD. So that's a big number. In the global situation, approximately 9.4% of children 2 to 17 years of age, so that's roughly 6.1 million, had been diagnosed with ADHD. This is according to a parent report in 2016. And when they broke that down into age groups, approximately 2 to 5, so that's around 388,000 children have ADHD. 6 to 11-year-olds, so that's around 2.4 million children have ADHD. And those in the older age group, which is 12 to 17, approximately 3.3 million children. So the numbers are really going up, especially in this new century. In one journal that I looked into, they noted now that children who are diagnosed with developmental disorders are more at risk of developing mental health problems compared to typically developing children. And that brings us to the issue of how do we manage these children who may have already a first diagnosis of a developmental disorder and now develop secondary behavior problems. So let's just go through a bit. What do we expect those children who are diagnosed with autism, with ADHD? What are the secondary behavior concerns that may develop from them? So in this talk, I will not be talking in depth into what autism is or ADHD. I will be zeroing in mainly on the secondary problems that come with the primary diagnosis. So we know for behaviors, we know that anxiety is a normal part of children's development. In a talk that I attended recently, it talked about stress. So we see a lot of stress right now in our children, in our young teens. But we know that stress is normal. The speaker then in that talk defined stress into two. There is eustress, that's EU, stress, and distress. Eustress is the good stress. This is what drives us to work more. This gives us the drive to reach our goals. But when you go to distress, that's when the problems come in. And distress may be related to anxiety. So as I mentioned, all of us experience anxiety. But our teens, our children in the autism spectrum can experience anxiety and stress more intensely and more often than our neurotypical children. So neurotypical children is the term that we use for children who don't have developmental concerns. Children and teenagers with autism, especially younger children, they have trouble telling us what they feel when they feel anxious. Instead, what we see are changes in behavior. Sometimes we see them go into aggression. They go into crying behavior. So these are challenging behaviors. So if we would break down those challenging behaviors, what do we see in our children with autism? We know that children with autism stick to their routines. They work better if it's a routine. But for challenging behavior, they become more insistent, even more on routine and sameness. So they get irritated if you change, for example, their pattern in the day, if you change the route where you go. For example, when you go to a certain place, they may seem to have more trouble sleeping. They have more meltdowns or more severe temper tantrums. They may withdraw from social situations. So if we put that into context of the COVID situation, of course, our social situations are quite limited. But when we look at a social situation which may be happening in the home, for example, a relative comes into the house for a short visit, they may withdraw or avoid that situation, even if, for example, prior, they were able to already adjust to a social situation. They rely more on obsessions and rituals, more lining up or spinning of objects. They have more self-stimulation, self-stimulatory behaviors like rocking, spinning, or flapping, and we see more aggression, like head banging, scratching of their skin, hand biting, hitting themselves, which are more challenging now. For those with ADHD, so attention deficit hyperactivity disorder, these individuals are more verbal. They are, most or majority of them don't have any language difficulty, so they can express themselves. However, what we see in terms of symptoms of anxiety is that eventually they develop oppositional defiant behavior. So 50% of young people may have oppositional defiant disorder. So what does it mean? When you say oppositional, you don't follow what is asked of you. Instead, you do the opposite. Defiance means you really do not follow. So if you put them together, and it happens more frequently, and it affects the functioning, it now becomes oppositional defiant disorder. 25% of children with ADHD may develop anxiety disorder. 33% may have depression. And 20% may have bipolar disorder. So when we have bipolar disorder, there is extreme signs of behaviors, like they may be quiet and calm during this period, and then suddenly they have outbursts of aggression or excessive impulsive behavior. Adolescents with untreated ADHD who are not given any form of management are at risk for substance abuse disorders. Some researches would show that young people treated for ADHD at a younger age actually have lower rates of substance abuse than children who may not be managed or given medications or given any form of program. So how do we approach, how do we manage these children? We need to use a combination of all of these things that you see on the screen to help manage the behaviors. So of course, when we have very young children, we have the options to have behavior therapy, occupational therapy for those who need help in language skills, in communication skills. We have speech therapy. For those who are ready to go into more academics or more educational types of activities, we have educational therapy. And the option for medication is always part of the management plan of individuals with developmental disorders. And that would be the focus of the succeeding slides that I will be sharing with you. So why? Why do we medicate? Are these medications given to cure the disorder, to treat the disorder? It's actually not. The main reasons why we give medications is to target specific symptoms. It's mainly to manage secondary behavior problems that I mentioned a while ago. So these behavior problems may include self-injurious behaviors or behaviors which may harm others or harm themselves. And the medications are there to help control the behaviors which may significantly affect their functioning. So why do we give medicines in autism? Again, as I mentioned, there is no medication that can cure autism spectrum disorder or all of its symptoms. Meaning, when we say cure, that means you remove, you treat all of the symptoms, and you go back to 100% normal. As of now, there is no medication that would really consistently cure autism. So medications can help symptoms associated with autism, especially behaviors like aggression, self-injury, seizures. So when we say seizures, these are movement problems. These are neurologic, so that's brain-related movement problems that happens because of some imbalance in the brain. Some would use this as epilepsy. Another term that we use is epilepsy. And also medications are used to control hyperactivity. Okay. What are the benefits? So in any treatment plan, there is always that balance between benefit and risk, or benefit and a negative response. So the benefits are it minimizes a symptom, which now would allow the person with autism to focus on other things, including learning and communication. So research shows that when you combine medication with behavior therapy programs for individuals needing medication, it shows more effective response and better response. Are there side effects to medications? Yes, that's the basic answer. All medicines have side effects. Even your vitamin C has a side effect. Even the paracetamol has a side effect. The most common side effects are gastrointestinal, so that's diarrhea or abdominal pain, some headaches, some would have agitation or they seem to be jittery. And there is, most of the time, there's weight gain, fine tremors, but there may be none also. So side effects happen mainly because, one, if the dosage is not appropriate. Two, it's really expected side effect from the medication, but which are considered to be mild. And three, it may be the individual's response. So again, we give medications for the following in ADHD. Why do we give them medications? We treat their anxiety, we treat their mood disorders, and number one is to control hyperactivity. We also would like to control conduct disorder. So conduct disorder means they really go into more negative behaviors, like there may be destruction to property, there may be, we call it elopement, or they go out of the house and they go to places that are not supposed to be, where children are not supposed to go. Treatments are also for seizure disorders, also to treat obsessive compulsive disorders, and for secondary psychiatric conditions. So what are these medications? So I may be mentioning some medical terms, but I would try to explain them. And if ever later on in the question and answer portion, if you have clarifications, I would be glad to answer them. So what are the medications that we use? First are the SSRIs. So that's the selective serotonin reuptake inhibitors. These are antidepressants. And this treats some problems that result from not balanced body chemical system. So the SSRIs are designed to lessen the frequency and the intensity of repetitive behaviors. It decreases anxiety, irritability, tantrums, and aggressive behaviors. And sometimes it's used to assist in improving eye contact. Another medication is tricyclic. It's also an antidepressant, but some would use tricyclics because this has lesser minor side effects as compared to SSRIs. Okay. We also have psychoactive or antipsychotic medications. I know some parents are quite hesitant when they hear the word antipsychotic because it would seem that the child already has a severe mental problem. But you know, in medical terms, we use terms, but it doesn't really reflect the severity of a disorder. So when you say antipsychosis, it just handles inappropriate behaviors, and they have to put it together in a category. So these medications decrease hyperactivity. They reduce stereotypical behavior. So stereotypical behaviors are the repetitive, inappropriate sensory behaviors that we see, especially in children with autism. It minimizes withdrawal and aggression among people with autism. We also use stimulants. So stimulants are used in ADHD and in individuals with autism who would have more frequent hyperactive behavior. So it's designed to increase focus and decrease hyperactivity. And it's also used in those individuals with mild autism symptoms. We use anti-anxiety medications. As it implies, it relieves anxiety and panic disorders, which are often seen in ASD. We use anticonvulsants. So these are the medications used to treat seizures and seizure disorders, because most of the time, 1/3 of individuals with autism have a risk of developing seizures or seizure disorders. So just to give you an idea, what are the names of these medicines that we use? So for depression, there's fluoxetine. For autism, what is more research on and studied on, for even for young children with autism, is risperidone. We also use sertraline for depression and anti-anxiety. We have aripiprazole. So that's a mouthful, no? It's hard to pronounce. But we use that for individuals who may have secondary psychotic behaviors, which would now lead to inappropriateness. Like for example, on top of autism, they now show some hallucinations, they show some depression behavior. So we start them on aripiprazole. And for ADHD, the most common medications that we use is methylphenidate. And there's another one, which is atomoxetine. Okay. We use imipramine for those with obsessive compulsive disorder, chlorpromazine for schizophrenia and aggression. And for those with more severe behavior, we use haloperidols. Okay. How do these medicines work? Why do we need these medicines? Because it acts on the chemical neurotransmitters. So what are the chemical neurotransmitters? If I would be explaining that in simple terms, all of us have that. So these are our body chemicals that we need to regulate our emotions. We have that in our brain. These chemicals maintain a balance. These are the ones which send a signal to our movement, to our emotions in terms of control or lack of control. So the common chemical neurotransmitters are dopamine, norepinephrine, and serotonin. So dopamine, if this is the chemical in our brain that helps us strive, helps us focus, help us look at things in an interesting way. Norepinephrine modulates behavior, and serotonin is the happy hormone. It mediates happiness. So if you have a good balance of all of these neurotransmitters, we don't have any behavior concerns. We can control ourselves. We can control our impulses, our aggression. But for those individuals who may have developmental disorders and would have secondary challenging behaviors, all of these chemicals are not balanced. So the medicines are there to help balance them, to add on if it's decreased in amount, or to stimulate production if needed. So that's how the medicines work. So we always have difficulties when we prescribe medications, because we know that there are a lot of apprehensions. So we have to consider all of this. And in my clinic personally, I really go into discussions with the parents about these medications. For parents, there are really apprehensions. There are sometimes limitations in understanding. There may be differences in expectations. Their decisions may be affected by what they hear in social media, what they listen to in social media. And of course, there's always that friendly advice from a neighbor that medication so and so caused this. But we have to address all of that, and we take time to explain that to parents. For the children, it depends on their developmental level. So we have to check what format of medicines can we use. Can this child swallow a tablet, a capsule, or mainly syrup form? And for those who can understand, especially for the young teenagers who are verbal and the ADHD kids, they have apprehension. So we address all of those. And of course, the doctor. So when we prescribe, we also have to make sure that what we use are things that we really understand also. So from the doctor's end, expertise and experience is important in prescribing. So as you can see from my slide, there is really a need to know what the benefits are, what the risks are, and a balance of those things for us to really decide that we have to medicate this child. So what are the factors to consider when we treat a child? Number one is the child's age. We have to understand what is the problem. Is it the disruptive behavior? Is it a learning or academic problem? Does it affect already relationships in school or at home? The severity of the problem. Is it manageable with just behavior or with behavior and medication? We have to check for comorbid or associated conditions. And of course, socioeconomic issues. There are a lot of alternative medicines. So sometimes you have to balance out what can the parent afford. If we need to give 2 medications, what would be the priority medication? So we have to know the access and the availability. If I would be talking about here in Mindanao, where I am situated in, not all areas have big drugstores who can supply the medication. So we have to take note of alternatives. So always we have to use an individualized treatment approach. And what are the things that we have to consider? We have to know the duration of action of the medicine. What is our experience and what is the safety history of the medicine? What is the availability and of course the cost, which is very important. Is it effective? What is the associated medical and family history? Is there a coexisting condition? What are the expected side effects? Are there contraindications? Is this medicine not allowed for this child? And of course, we have to talk and plan out compliance. Can the child really maintain the medication? Can the parent adhere to the medication? And more importantly, is there parental consent? Because most of the time, what we deal with are minors. So it's really the parent who have to give us the consent. The doctors, we give the benefits, the plan, the management. But of course, at the end of the day, we know it's the choice of the parent whether they will give it to the child or not. So part of our counseling is really to make sure that the parent understands why we are doing this and why we are giving the medications. Okay, so what do we do when we plan out medication? So we explain that a careful, diligent evaluation and diagnosis are the key to effective treatment. And again, medicines are not a cure. And medicines are not the only treatment. We are targeting specific symptoms. Parents need to be involved. We have to understand the degree of effect of symptoms on the day-to-day functioning of the child. And we also have to be ready that the most common cause of treatment failure is poor adherence. And number 8, that is what I always tell my parents, the parents of my patients, please communicate. Always give me an update. Tell me what you observe in your child, because I cannot see you every day. But one beauty again of social media, I have a specific business page for concerns of parents. You have to tell me, what do you observe in your child? Is there a good effect? Do you observe side effects, so that we can plan if we need to adjust the dose, change the timing, etc. So for those who are also with other doctors, I always tell them, talk with your doctor. The doctors are there to listen to your concerns. Okay. Because as in any situation, I'm almost done, so that we'll have more time for questions. In any situation, in any time that we manage children with special needs, we have to recognize that it's the patient in the middle. That is our primary concern. The family, the doctors, the therapists, the teachers, the school, the community, we all are linked together, because all of us need to work hand in hand for the betterment of the child with special need. And that should always be our priority. It's always a shared responsibility among all of us. We need to work hand in hand so that we can really maximize the potentials of our children. And I think that's my last slide. So I would like again to say thank you for listening in to this short lecture for this morning. If you have any questions, I think Lisa has allotted some time for question and answer. Lisa, you're muted. There.
Yes. Hi there. We have a question that I'm now seeing here. Is autism hereditary?
Okay. As in majority of developmental disorders, we really cannot pinpoint a single cause of why a certain disorder would happen. If we would speak specifically of autism, there are researches which would show that there is a certain percentage of children with autism which may be genetic or hereditary, meaning somewhere in the family line, there is really that occurrence, or there is really a lot of family members, whether it's in the first, second, or third generation, who may have similar symptoms to autism. Only a certain percentage may be clearly hereditary. They are looking into an interplay of genetics or environment, but as I mentioned, up until now, there is no consistent research finding which would pinpoint to a specific cause for autism.
The next question I think is a good one. Is it okay to have our kids with autism vaccinated with the COVID vaccine?
Yeah, I'm glad that question is raised. Thank you very much for that question, because we are in a situation where it's not the usual. I am a pediatrician. I am an advocate for vaccines, because we know that these vaccines are researched on, and with regards to benefit versus risk, we are in a situation where we need the vaccine to protect not only the adults, but also the children. The world is starting to open up, and we need more opportunities for our children to go out. So one way of protecting them is to give them vaccines. Our children who may have special needs like autism, some researchers would show that they are more at risk for developing certain illnesses, mainly because, number one, of their behaviors. Majority of young individuals with autism don't like to wear a mask in places where they're supposed to wear a mask. So the vaccine would give them another layer of protection. They may also be at risk for developing more illnesses. So researchers would show that individuals, whether with autism or without autism, children who may not have any developmental disorders may benefit from giving the COVID vaccine. My personal experience, I have already a lot of patients who have received the vaccine. When the vaccine rollout was for the older teenagers and the older individuals with autism, the Autism Society here in Davao actually even organized a vaccine day for these individuals. So the short answer, yes, I advocate for giving vaccines to these individuals with autism.
The next question that we have is, you covered that, any side effects? Of what age is a child's autism is being, I think at what age maybe child autism being observed or diagnosed? At what age do you start to observe maybe for a diagnosis? What are the most common signs of an autism in toddlers? Mm-hmm. What are the signs to look for, and what age would we be looking for observation or diagnostics?
Yes. Yeah. Well, maybe they want to know what are the signs or the earliest signs that we observe in a child. You know, we have red flags. When we say red flags, these are the initial signs and symptoms that we may be observing that might be a suggestion that there is a developmental condition. There is no specific age, like by age 1, there is this age that you can really diagnose for children with autism. You can see red flags at any point, even as young as 1 year of age, when you are expecting language, for example. But most of the time, majority of the symptoms are observed by the time that they reach 2 years of age. Most of the time, this is the age when they see the doctor for consult, because this is when we are waiting for the child to talk and the child is not yet talking. And some of the early signs, I think that is one of the concerns that the question was raised in a toddler. So when we say toddler, that's the 0 to 2 year old age group. Some of the most common signs is, number 1, speech delay. The absence of clear, meaningful speech. So that includes calling the parent or mama. The absence of a gesture, which is pointing. Pointing is a very important word to show what you want, to point to things that is asked from you. So that is absent in a child with autism. They seem not to want to interact with other people, even their parents or their siblings. When they play, there is stereotypical play. So they may be lining up things instead of, for example, a car. Instead of letting the car run, they would spin it. They would turn it over and spin the wheel. They may have excessive anxiety, tantrums. They may not want to look you in the eye. So those are some of the early signs of autism.
And Dr. Izagiri, you may not be able to answer this question because I know you were saying, but we'll ask it and you can say if you can answer it or not. But what brand of vaccine can you recommend for an 18-year-old with autism?
I am not a vaccine expert, but what is recommended right now for 18-year-old, I don't know if I can say the brand here, but what's commonly used is, I think, Pfizer. But for 18 is already a young adult, so they are opening up all brands actually. The main thing that is always mentioned is whatever is vaccine available, that's the best vaccine. Okay. Yeah. For younger children, there are more specifics, but for 18 and above, that's an adult stage, so any vaccine can be given.
The other question here, which I know there were some questions around actually, managing behaviors with the child that's having tantrums. And I was just going to say that I'm going to refer you guys to actually go check out the videos that we have on our YouTube channel and also on our Facebook page, because we definitely have quite a few different webinars and seminars that you can go back and listen to that is specifically around how to address behaviors. So I would highly recommend anybody who's listening to these, but now and had that question, to go look at some of the other videos that we've done, webinars that we've done around managing behaviors. And then the other question that I want to thank Maria for asking is if there's any support systems for parents who have children with autism, like forums or seminars that parents who are having a difficulty dealing with the autism. And I have to say, that is the reason that I formed the Phoenicia Foundation, is that I want to be able to put on these webinars, workshops, and to bring families together to support one another. And so when pre-pandemic, we were doing outreaches in the Philippines where we were putting on such trainings, we were going and doing diagnostics and doing parent support so that families can come together and support one another. So If you don't mind, Maria, if you don't mind reaching out directly to me on our Facebook chat messenger, and you and I can connect offline, and I will be more than willing to provide support to you. And then we have a couple more questions. So my son is stressed. He sometimes hits himself. What is the reason behind the behavior? How to avoid and control this behavior? He's not taking any medication. Yes, we're thankful for these webinars.
Yeah. First, I would just like to know from Miss Grace Malyari, is the diagnosis autism, or is there a different developmental disorder for your child? If it is, I'm just going through, high functioning autism. Thank you for the reply. As I mentioned, these individuals who may have these developmental disorders are more at risk for challenging behaviors. Stress is a part of day-to-day life. It's how we handle the stress, which is very important. And we know for those with developmental disorders, they may not know how to handle it. So one manifestation or one symptom that he is showing that he's stressed is the hitting behavior. So that's already aggression. That's already self-injury. So the reason behind may be because he cannot handle the stress. He cannot explain it. Individuals with autism, specifically high functioning, they may not be able to put into words the feelings that they have inside. They have the same emotions as all of us, but they cannot seem to handle these emotions. They cannot seem to have self-control over these emotions or showing these emotions to us. So what do they do? They manifest these behaviors. They hit themselves because they get frustrated. For those who don't have developmental disorders, frustrations may be seen, maybe, for example, as just simple banging of the door or answering back to your parents. But for these individuals who may not be able to do that, they show a gesture. And the gesture, unfortunately, may be self-injury. So how to avoid it? Again, it depends on the age of your child, what programs he is in right now. So there might be a need to review the programs that he's receiving. Maybe if he's on any behavior or occupational therapy program, some activities would be added on. If there's a need, medications might come in again. So it's a combination of all of these things to handle that specific behavior.
And Dr. Izagiri, I'm going to just kind of weigh in from a parent of now an 18-year-old child with high needs of autism. I had found that when my son would display such behaviors, it often came from a couple of things, and we still see it today, is sensory overload. And two, the other one, often when we really see that he's doing any kind of self-injuries, it's normally when he's not feeling well or he's starting to come down with something. And particularly because he doesn't have the verbal skills to be able to communicate that he doesn't feel well, that often as soon as we start to see that kind of hitting the head or other things, we often find that there's maybe an underlying of possibly headache, stomach ache, not feeling well is another thing that we've found.
Yeah. Medical problem, yeah, right.
Yeah. And then the last question that we have on here is there any milk formula that is good for a child with autism?
Unfortunately, based on research, there's none. There's no specific milk that would say that it's better for a child with autism or not better for a child with autism. So even if you have a lot, I know there's a lot of milk formula which are supposed to be given to improve behaviors, to improve communication, but these are not evidence-based. And for us developmental pediatricians, we have to look at the evidence before we would say that this is better than the other one.
Well, I sincerely thank you, Dr. Izagiri. I am so honored that I get to work with you, partner with you, and that we have you on our advisory board for Phoenicia. I love when I'm able to collaborate with you, and I know you have a very busy schedule, and I can't thank you enough for taking the time out of your day to be able to do this for our parents, teachers, caretakers, our community. It's totally from the bottom of my heart, greatly appreciated. And I can't wait to see you in person in I think it's actually going to maybe happen. So I look forward to seeing you in person. I want to thank everybody for joining us. Any questions, feel free to reach out to us on our Facebook Messenger page. And we will be in touch with everybody who signed up with some follow-up information and the links to where this will also be stored on our YouTube channel. So thank you, everyone. Have a wonderful day, evening, morning, wherever you are across the world. Take care, everyone. Bye-bye.